Hi, I'm Captain Cothran, Chief Deputy for Newton County Sheriff's Office, and today I'm on the road with County Public Health Nurse Kim Durham. Hi, Kim.
Hello, good morning to everybody.
I know we've been working on this for a couple days and you've had an extremely busy schedule, so let's just cut to the chase.
Okay.
COVID-19. There's a lot of information out there for people. What are some trusted sources?
And it is important to address trusted sources because there is a lot of misinformation out there. So what we recommend that people do is to lean on government or state-based websites, which is where you're going to find the most up-to-date and the most reliable information. What we use is the Indiana State Department of Health website. That's at www.isdh.in.gov. There's several links in there where you can click and you can get public information. There's even information for healthcare providers and others. We also very, very heavily lean on the CDC website, which is www.cdc.gov. Both of them have a wealth of info on there.
And we can put the links in the description of the video so that people have the links as well.
That's perfect. Okay. We also have our county website, which we're trying to update as often as possible. It's a little bit harder due to time constraints and the fact that the information is updated so quickly that a lot of times by the time we post it, it's already outdated, but we're doing the best we can with that. So that is at www.newtoncounty.in.gov. So you can check on there on the main web page. There are links that you can look at. We're also trying to utilize the Facebook platforms for both the Sheriff's Department, which you'll find this on, and Emergency Management, Newton County Emergency Management also posts some informational stuff on their website as well on Facebook. We do have a specific COVID-19 hotline that the State Department of Health has. I do want to put those out there for those of you that have questions about COVID, both in the public sector and as well as healthcare providers. That number is 877-826-0011. Also, if you have specific questions, you can contact the health department. Our phone number is 219-285-2052.
Right. Symptoms, what are they?
Symptoms. The hallmark symptoms of COVID-19 are pretty specific, really, in a lot of ways. What you're going to see most often in adults is a significant fever. Significant fever in our mind is 100.4 or higher. A lot of folks are presenting with, temperatures of 102 or more. So that's something that you're almost definitely going to see in the event of a case. Also, upper respiratory issues. That would be coughing. It's usually a dry cough, but that was almost always present as well. Some patients will have shortness of breath. They'll notice that their lungs feel tight or heavy. That's one of the more common things that we see. Some folks have body aches with this, but not a lot of stomach issues seen in that on occasion, but that's more rare. Something that we do note is that there's a lot of allergy issues going on right now. It is allergy season. COVID-19 does not generally cause sinus issues. There's not a lot of runny nose. There's not as much sore throat, not a lot of drainage, that kind of thing that you'll see with allergy issues this time of year. So if you've got a lot of sinus involvement, that's generally not a COVID-19 sort of indicator. So like I said, also if you do notice that you've got a lot of upper congestion, most of the time with allergies, you're not going to run a fever.
Okay.
So those patients that need to be more concerned about COVID-19 would be ones that are running the significant fever and have the lung issues.
All right, so if I wake up tomorrow and I have a temperature of around 100, a scratchy throat, a little bit of a cough, and I'm thinking, oh no, I have the symptoms, what do I do?
What we recommend right now, if you are feeling poorly enough that you feel that you need to be seen, which would normally be somebody that you feel like you're getting a little too short of breath and you're really concerned about your health, at that point we recommend that people contact their healthcare provider, and that way they can help direct them a little bit further about whether or not they need to be seen, if they think that testing could possibly be a possibility. Most folks, though, if you're not feeling sick enough that you feel that you need to seek medical attention right away, the recommendation is that you take care of yourself at home as best you can. Of course, we're letting everybody know too, if you are at a point where it is a medical emergency where you're very short of breath and you feel that you need to have immediate assistance, we would like for folks to call, if they call their healthcare provider, let them know these are my symptoms. I could possibly be, I think I might have this COVID-19. If you happen to call for an ambulance, please let them know. If you call for any kind of first response, let them know. If you decide that you're going to report to an emergency room, call ahead and let them know that you're coming.
All right. And obviously we're practicing our own social distancing.
Yes,
here,
we got a pretty big gap here.
today. Yeah, we do. But what, people are staying at home. Let's talk about some in-home sanitation that really hasn't been addressed as far as what I've seen of, okay, now we have 4 or 5 people in the house. Let's talk about home sanitation.
Okay. And actually, there, just to let everybody know, there are great documents on the CDC website about guidelines for those that are caring for people with COVID-19 at home, or if they have it themselves, what they should do to try to limit exposure to other people in the home. What we recommend is if you're sick, try and stay in your own room if you have that option. Try to use your own restroom if you have that option. If you don't, the best thing that we're looking for, at least try to find some place for other people to sleep. Spending a lot of time in the same room is a bad idea. So we're asking folks to don't share linens, don't share utensils, anything where you could be sharing any kind of body fluids is not recommended. So if you're using towels and things like that in the bathroom, take your towels and put them in the laundry separate. You don't want to use them, you don't have it, risk anybody else in the house sharing a hand towel or something of that nature. Same thing with sheets. If you're washing linens, if you have gloves at home that you can use when you're handling those things, that's the best. If you don't, then make sure and do hand hygiene after handling anything like that. Try to hold it away from your body when you're taking it to put it in the laundry or whatever you're going to put it in until you can wash it. But when you wash on the highest temperature settings that you can for whatever fabric you have. Try to make sure that the person in the room, the sick person, has tissues to use if they can, or to sneeze or cough in their elbow to avoid any kind of respiratory secretions from going out around them. If someone has to go in the room, if they can mask up, that'd be great. I know masks are in short supply. That's a hard thing to do. If a person has to be in the room, though, if they don't have a mask, please limit your time that you're spending in that room. High traffic surfaces in the house should be wiped down several times a day. Of course, hand hygiene, washing your hands in soapy water for 20 seconds per wash is the best thing that you can do, avoiding touching your face.
I've seen kids at other kids' house having kind of a group gathering, and if they're passing their phone around, looking at this video or that's a contagion as well, correct?
Absolutely. Cell phones are a great source of sharing germs, so that is something that you're going to want to do. Just a basic alcohol pad, wipe your cell phone down, or whatever kind of you could probably use a Clorox wipe or something of that nature.
And with the shelter in place, and I know the kids are getting restless at this point too, but let's give some tips on having your friends come over and sleepovers and.
Well, and at this point, and once again, I have a young daughter, and she is bored out of her mind because I have been practicing my social distancing very strictly with her for the last couple weeks already. However, going into the stay-at-home order that the governor issued, I think it is best practice if your child is following the order just the same as adults should be following the order, which means no visitors, siblings only. We're trying to keep as many people distanced as humanly possible. Kids can sometimes have COVID-19. Their symptoms are not always quite as strong as adults. Their cases are sometimes more mild, and they can be a carrier. So it really is imperative that families take this order seriously. And like I had mentioned earlier to you, these are orders like a stay-at-home order are a huge economic burden. The state is not going to call for something like that unless they're taking the situation seriously, which is what I feel like is not necessary to panic. We want folks to remain calm and think things out, and this is nothing to panic about, but it is something to prepare for and be intelligent about it and take seriously, because we do want to protect the most vulnerable people in the population, which at this point we know to be elderly people and those with underlying health conditions and immunocompromised, things like that. We want to make sure to keep those people protected. So.
Okay. And while everybody's sheltered in place and stuck at home together, if you will, it might be a great time to get to know your family again. Board games.
Yeah, absolutely. Board games. If the weather's okay, outside is great. I mean, I think that exercise and fresh air is going to be good for everybody. Mental health too. I mean, we want to make sure that folks aren't holding up, in their house, in their rooms with their going on their social media and seeing a lot of stuff that quite frankly isn't true.
Yeah, there's a lot of misinformation.
There is a lot of misinformation out there, and it's very difficult for us in public health, and I know for you in your line of work as well, to deal with misinformation and rumor and fear mongering, things like that. It's really important to try to keep that under control. So I recommend that people, try to stay off of social media a little bit, try to stay off of, websites that you maybe can't trust, and, inform yourself. But, since you're home with your family, if you are able to be home with your family, which a lot of folks are, try to connect with them. Like I said, drawing and writing and reading and things that are mentally healthy and interesting and engaging for them. And they'll actually, this is it's a time of upheaval for kids. It's very disrupting for them, and trying to reassure them with kind of keeping things normalized and being honest with them, but not frightening them when you kind of explain what you're doing, but engaging them and try to make them feel a little bit more calm and normalized.
Sure, especially with the work situation that, mom and dad are home from work for a while, the whole economic side of this. I mean, we all need to try to protect our kids, but also educate them in what's going on. From the sheriff's office side of this, I think we need to take the opportunity to start warning people of the potential scams that will be coming with this. We've heard of a few of them nationally, but not locally. You start getting the phone calls. First of all, somebody comes to your house. If you don't know them, I wouldn't even open the door. But when you start getting the phone calls for the virus could live within your heating vents and things like that, don't jump on that. Do some research. Don't commit anything. As always, don't give anyone your banking information, your credit card information. Research that information before you start committing to any type of scam that comes out there.
I've been trying to encourage people to reach out to maybe what we would call our vulnerable population, which might be elderly people, neighbors that can't get out, maybe someone that that is immunocompromised. Ask them what they might need help with in a situation like this. Like, for instance, if you can reach out to an elderly neighbor and talk to them, Murphy's grocery store in Kentland does, you can order online and go pick up an order. You could go pick up an order of groceries for them. You could go to the pharmacy for them. If first responders or, healthcare workers that are extremely busy right now, if they need a hand with their kids, if they need a hand with whatever, it's good to reach out to those folks and say, hey, is there anything that I can do for you while you're, struggling through this whole thing? You can arrange childcare, whatever. Also, we have been letting people know that there is a shortage of blood. Red Cross really does need help with blood donation. If there's something that you want to do to help, you can contact Red Cross, and they are taking into account personal safety during viral spread. So I'm assuming that they are probably doing things by appointment and not having a bunch of people in a donation area. But they have information on their website that is at www.redcrossblood.org.
Kim, has there been any positive results for Newton County?
No, not yet. We do have individuals within the county that are being tested, and those I'm made aware of, but we do not have any positive cases right now. When that happens, and I'm sure it will at some point, we will issue a press release, and that way the public can know that there's a case, and they'll see it on the ISDH website, the State Department of Health website. They do have an interactive map on there that has a list of cases and what counties they're in and that kind of thing. So. And
that map, is that like within 4 hours? I'm sure it's not a live
It's
time.
It's only updated daily. It's updated daily at 10 o'clock or 9 o'clock our time in the morning. And that's cases and things like that have been reported up until midnight the day before. So it's not real time, but it's within 24 hours. So. Okay.
And if I could also ask you to clear up and give us some direction, because again, there's a lot of misinformation out there. What constitutes an exposure or a contact?
and we've gotten a lot of questions about this. It's obviously a contagious disease, and we don't want to have that not taken lightly. However, what being in the same building as somebody that is positive does not automatically make you a contact. Within our world, what we consider to be a close contact and somebody that we would want to talk to regarding an exposure to COVID-19 would be someone that, and bear in mind, this is if you have been symptomatic. There's a lot of confusion too about asymptomatic spread of this. At this point, within State Department of Health guidance, we're looking at people that are symptomatic, okay, with symptoms at the time. You would be considered a close contact if you're living in the same household as a person that has COVID-19 and they have symptoms. Caring for a person with COVID-19 while they're symptomatic.
That has tested positive.
That is tested positive and they're symptomatic. Being within 6 feet of a positive COVID-19 person for about 10 minutes or longer, and they have to be symptomatic at the time. And then the final is being in direct contact with respiratory secretions, which would be them coughing on you, kissing, sharing drinks or utensils, that kind of thing, with someone that's a positive case while they're symptomatic. So that makes things a little bit tighter as far as what you would call exposure. Walking by somebody in the grocery store, unless they cough directly on you when you walk by, is not considered an exposure. Just that would not be enough for that disease. Now, I know that you also, and the reason why we're washing our hands and not touching our face and things like that, is that supposedly spread from surfaces can happen. But from the guidance that we have received and all the information that we have on hand, they believe that the primary way that this stuff spreads is via respiratory droplets from someone in close proximity.
Okay.
I mean, it's not as much, they don't think it's as much transfer from surfaces to hands to the body. But because that is something that you can control easily, your hand hygiene and things like that, they still, the State Department of Health and CDC still recommends that people make sure and keep their hands clean and that kind of thing, just to prevent, try to rule that out a little bit. But like I said, I think the primary way of contact is via respiratory droplets.
Okay. Well, Kim, I appreciate you taking the time. Hopefully this will clear some stuff up. It'll give some resources so people are looking for the correct information instead of the misguided social media stuff that's out there. I'm sure any press releases that you have that will be shared by our office's Facebook page, also EMA's. And I'm sure at this point you're probably a couple hours behind for doing the video. So I appreciate you taking your time. Thank you very much.
Thank you for having me.